session. So we request you to stay in the programs for next 2 sessions.
So can you
topic है जो
so can you join little later?
Namaskar, sir.
Yes.
Tuteja,
We
sir.
thank our program director for Dr. M.K.C. Nair, sir, to spare a few moments with us. Now I request Dr. Tuteja, sir, our guest of honor, to please address us, sir.
Recording start कराना है, था कर दिया.
Past chairperson of AHA, sir.
Thank you very much for asking me to be here on this day. And that it's good that we are doing a counseling session, which is required not only on our country but across the planet. From last 6 months, I was not here, but I have seen a lot of activities going on without any patience. These all diseases which we are going to talk, metabolic diseases. In America, it has been now called as horseman's disease.
Horseman's.
Horseman diseases.
How do you spell
Is
it?
the net? Hello?
How do you
Please
spell
don't interfere.
How?
Don't interfere, please.
Okay, please.
These are all now called horseman diseases in USA. You can say that non-communicable diseases, you can say it is non-infectious diseases, which is the era is coming up, and the era will be medical 3 now. My boss, my guru, has already talked about Dr. M.K.C. Nair, sir, but I would like to add few things in that, in his statement. There are 5 things are required now in coming era. There are fundamentally 5 things are required. They are exercise, sleep, then environment health, emotional health, which is the cause of all the non-infectious diseases across the planet. Then you need nutrition. We were giving more concentration to the carbohydrate and fat. Fat is required for the good brain function, but not to the extent that it surrounds your vital organs so that they degenerate very easily. The exogenous molecule which is now is required to tell your teenagers to become centenarian in the future is the protein, which is the need of the today. Thank you very much.
Thank you, sir. Thank you. Thank you.
Thank you.
Thank you, Tuteja, sir.
Thank you, sir.
Thanks a lot, sir. So we are blessed today to begin our session with the blessings of Dr. Tuteja, sir, and Dr. M.K.C. Nair, sir. So happy afternoon, everyone. On behalf of IAPHA, once again, I, Dr. Kavita Meghani, welcome you all for this 5th session of Counseling webinar series, Basics to Advance, under the able guidance of Dr. Hima Bindu ma'am and direction of respected teacher, Dr. M.K.C. Nair, sir, and with the support of our entire AHA and IAP team. As sir said, with improvement of global vaccination, now childhood disease trend has shifting from infectious diseases to metabolic and mental disorders. So metabolic syndrome is rising exponentially, as we discussed right now, and it is the result of today's era's bed lifestyle. So our today's eminent speakers are going to share their wisdom on this burning topic today. And today the speakers of today's session with us are well-known personalities: Dr. Sukanta Chatterjee, sir, past IPHA chairperson; Dr. Poonam Bhatia ma'am; Dr. Madhushri Deshpande ma'am; Dr. Santa Chattopadhyay. As I have already shared their introductions in the group, so I'm not going to take that in detail. And I straightforward request Dr. Santa to start the presentation. Thank you, ma'am. Thank you.
Thank you, ma'am. Is my slide visible, ma'am?
Yeah.
Yes, you are.
Make it full screen, Santa.
Yes, I'm making.
Yes.
So, very good afternoon to all. I hope I'm audible, loud and clear.
Yes.
Yes.
So, a very good afternoon to all, and I extend my sincere thanks to Himabindu ma'am and her esteemed team for giving me this opportunity to share the platform with my revered teachers and seniors. My highest regards to them. And I would also congratulate and appreciate the mentor behind structuring this adolescent counseling session program to have included this topic of today's, that is metabolic health and how to break the chain of NCDs, which is undoubtedly, yes, the most burning issue of today in this fast world, in this fast life. So, life has been fast for us over several decades, and now it has become faster. And there are people in our lives now who want to make things easier for us, and I have no conflict of interest with them. Rather, at the very outset, let me take you through the recent buzz that surfaced over a government directive. This directive urges that oil and sugar boards be installed in schools, cafeterias, and public places to highlight how much fat and sugar lurk in our everyday snacks. And ever since the issuance of this directive, much debate flooded the social media platforms whether this meant raising statutory warnings against the age old popular Indian snack cultures of samosas and jalebis. Your mouth could be watering now, but I wouldn't get into this debate. Rather, I would like to draw your attention to the directive itself, which I found that spoke volumes on the genuine concerns about metabolic ill health in the Indian population across all ages. So, this has recognized the ever increasing burden of metabolic ill health, just as we are discussing now, stating that India is witnessing a sharp rise in obesity and in both adults and children. And as per the NFHS 5 data, over 1 in 5 adults in urban areas are overweight or obese. It also raised concern about the Lancet Global Burden of Disease 2021 obesity forecasting study published in this very current year, which projected that the number of overweight and obese adults in India would rise from 18 crores in 2021 to a whopping 45 crores by 2050, and that India would emerge as the country with the second highest burden of obesity. And that the government also realizes that this increased prevalence is impacted by the poor dietary habits and the reduced physical activity, which are so rampant today. And this, if not addressed duly, can significantly raise the risk of NCDs such as diabetes, hypertension, heart disease, certain cancers, and even mental health. So it also raised alarm that not only physical health outcomes, just as Sir was telling that, but mental health, even mobility, quality of life, healthcare costs, and productivity would be deeply affected in the long run. And so the clarion call to display sugar and oil boards in schools, offices, public institutions alike settings, where these boards would serve as visual behavioral nudges to make people take up healthier and better options for acquiring good health. And all this started after CBSE directed all the affiliated schools to establish sugar boards to educate students about the dangers of excessive sugar consumption. And beyond displaying such boards, it also urges all to adopt healthy lifestyle measures like including more fruits, vegetables, and limiting sugary drinks, and also to incorporate as much as possible physical activity in our day-to-day life. And I think that all of us would agree that this call for awareness and action for achieving good health are just the needs of the hour. IIP, however, has all through been contributing to the process. There are many initiatives. To name a few, the coining of the acronym JUNKS to fight the unhealthy food products, to the most recent Well Youth initiative under the Presidential Action Plan, and hope we have all watched this short film Disha 2, the U-turn on obesity awareness and the role of early intervention, which got released in this very current year from IIP's end. So just as Sir was telling that though unhealthy food intake, physical inactivity, these are the two major contributors to metabolic dysfunction, we as physicians know that there are more determinants. And it is the interplay of all these determinants, diet, exercise, sleep, stress, the environmental and the social milieu that surround us, all determine our metabolic health when put together. Now, this is a very beautiful slide which has been shared to me by Dr. Madhusri ma'am. And this slide very beautifully illustrates how a life course perspective, starting from preconception through adolescence, highlights the cumulative effect of biological, behavioral, and social risk factors on the long-term health outcomes. It emphasizes how factors beginning as early as preconception, like genetic predisposition, ethnicity, maternal weight gain even before conception happens, all that can be significant risk factors to metabolic dysfunction. And also during pregnancy, excessive weight gain by the mother, gestational diabetes, adverse uterine environment, and during infancy, faulty feeding practices like lack of breastfeeding, early introduction of solids, rapid weight gain, these early exposures can can predispose the child to obesity and metabolic disorders. And all through unhealthy diet, limited physical activity, inadequate sleep, they could contribute significantly. And when it comes to adolescents, to add to the list are their risk-taking behaviors, their mental health issues, and even the pubertal changes. There are some social determinants too, like low socioeconomic status, insecurities in the areas of food and housing, financial barriers, and so on. So to build on this, I would invite our expert, Sir Dr. Shukanta Chatterjee. Sir, because we are doing an adolescent counseling session program today, we'd like to know a little more in detail, sir, why metabolic health is so critical in the adolescents, and does puberty have any physiological effect on insulin sensitivity?
Well, thank you, Shanta. Am I audible?
Yes, sir. Audible.
Okay. So why metabolic health is important in adolescence? There are multiple reasons. The first reason is that we see that adolescents, particularly in early puberty ages, they gain some weight or fat. So people think that this fatty change is normal, and then when they will grow in height, this fat will ultimately get neutralized. But this may not happen always. So this is one point. Second point is during puberty, their lifestyle changes significantly. How it changes? They are more prone to concentrate on their studies, and they are more prone to concentrate on tuitions and all that. So that takes away their playtime and all that. Then their own instinct takes them to the say sedentary habits of say screen time increase, and also talking to the friends without going outdoors for activities on all that. And then additional problem is that their foods are often taken in a hurry and often food from outside. This outside food is not only their own passion to take food from outside or their choice or independence, but it's a compulsion sometimes because they stay long hours away from home. So these are all putting on metabolic stress to the adolescents, and often they are not aware of it, that this is going to affect them. The type 2 diabetes, which in our days are considered an adult disease, now it's being increasingly recognized in adolescents. And this sort of lifestyle, a little weight gain and obesity ultimately leads to different forms of mental health distortions like anxiety, depression, lack of acceptance by the peers, low self-esteem, and others. So ultimately, this sedentary habit leads to fatigue, poor sleep, and we all know if the sleep is not adequate, then the next day activity is totally affected. So their concentration is also reduced, their study is affected, and their performance in all sectors, including the energy for any physical activity, also affected. Then in the metabolic risk, the girls are equally affected by the polycystic ovarian syndrome and menstrual irregularities. And early prevention can reduce future risk of type 2 diabetes, cardiovascular disease, and non-alcoholic fatty liver disease, what we call the NCDs. Next slide, please.
Yes, sir.
Well, then the question of how puberty affects insulin sensitivity. This is something which is also related to the metabolic syndrome or a little fat spot, and that is not considered as a caution. That is due to the reason that the physiologically the growth hormone and the insulin-like growth factor ultimately comes in, and also the sex steroids, they actually reduces the sensitivity of the insulin. Moreover, in this age group, the natural insensitivity of insulin comes, like say why the in puberty we suddenly get sex steroid surge, we get the growth hormone surge. These are say time honored, say I should say trigger that comes in. So that is why the insulin sensitivity is reduced, and that is further triggered by growth hormone, sex steroids, and other. So unless it is recognized by late adolescence, when normal insulin sensitivity returns, it may not return due to obesity, and the ultimately obesity and the fatigue and other things might continue to the individual as a metabolic syndrome and many other issues. Now this puberty insulin resistance becomes problematic when there is excess weight or obesity, the insulin cannot manage it, sedentary lifestyle, and high sugar or fat diet. And this might lead to persistent insulin resistance, hyperinsulinemia, and increased metabolic syndrome, type 2 diabetes, and PCOS. So insulin resistance has got multiple dimensions. It might lead not only to type 2 diabetes, hypertension, it might lead to impaired glucose tolerance, obesity, that's more truncal obesity or central obesity, then hyperuricemia, acanthosis nigrans, that is often a very good clinical sign of say insulin resistance, but acanthosis nigrans should never be considered say, a normal phenomenon. It should be considered an alarm sign. Decreased fibrinolytic activity and dyslipidemia and atherosclerosis starts from this age. So all these things can come due to insulin sensitivity problems. Next.
Okay, thank you. Thank you so much, sir.
Please
So
proceed,
yes,
Shanta. Yes.
yes. Thank you, sir, for elaborating so well. And no wonder the adolescents are at risk for developing metabolic dysfunctions. So I'll refer to a case now, and I'll go back to you, sir. So here we have 12 years old Rishi, who studies in class 7. He's developmentally normal. He was brought to the OPD by his mother, who was worried because of his increasing body weight, laziness, and declining academic performance. So, a simple case, but a very common case in our day-to-day practice now. And the doctor noticed that the boy was sitting and busy playing a video game in his mobile phone at the clinic itself, and he looked visibly fat. And the mother was seen warning him to put the phone away, and then turning to the doctor complaining about the increasing screen time and the lack of physical activity in her son. And she also added that these changes accelerated from the COVID lockdown period time. And she also mentioned that her son consumed a lot of junk food quite often. So I would ask again, Shukanta sir, so when such a case comes to us with this weight issues and screen addiction and declining academic performance, what are the important points that we look for in the history?
So the first point, that is the presenting problem, the weight gain. So is this weight gain sudden or it's gradual? So if it is sudden, then we should consider some pathological conditions, acute things. If it's gradual, then it's lifestyle related issues and more towards our today's topic, that's pointing towards metabolic health. Are there any other concerns like fatigue, breathlessness, or snoring at night? Because fatigue is very common due to obesity itself. The overweight body, the system cannot sustain for longer time for any activity. It gets easily fatigued, and the adolescent doesn't like to be active. So they just sit and sit in front of the TV or in front of the phone, what they want or they desire, and then in between they starts taking snacks also. So this is increasing the cycle and obesity and other things. Breathlessness, of course, gradually this is taking the respiratory and the cardiac functions, and a lot of fat that leads to breathlessness during activity also. Snoring is another point that leads to not only the problem of breathing, but it leads to problem of good sleep in the night. That spoils the next day, and the entire day is fatigued and the effortless. Then the developmental behavior history, we should take any mood change, irritability, poor concentration. Does the same withdrawn, anxious, or show any sign of low self-esteem? Because this is very common. Low self-esteem is very common when the adolescent himself or herself is not satisfied with his own body activity, which his peers are doing. So low self-esteem is not uncommon in these situations. Then the dietary history, number of meals per day, and the usual food items. Food item is also important, as it is said by not only MKC and Dr. Tuteja sir, but also it is mentioned by Shanta that food item is very important, but they are sitting now, maybe at home, but still the food items may not be ideal. That is very important. So details of food items we need to know. And the frequency of junk foods, sugar beverages, particularly late night snacks. They often go to the bed with the cell phone and may remain awake late night and take the snacks from their say bags or stored in the room. So skipping meals is another problem, particularly breakfast, because breakfast is considered the food for the brain, and therefore the brain is not working, so everything is deranged. And then there could be problem in the families, family issues, and emotional issues, and even the boredom that I am not liked by anyone, the friends are not allowed to talk to, so that boredom ultimately leads to nothing to do, so let us open the snacks packet and take some. So this sort of things might also come that we have to take in the history. Then lifestyle and physical activity, particularly the time spent on screen and time spent outside home due to some physical activities like sports, outdoor play, or walking, or going to a friend's house, or whatever. Now, this COVID lockdown is mentioned, but I must say that let COVID not return, but the COVID is not the only culprit. It is the metabolic syndrome or problem is a problem of today's adolescents' lifestyle and all that. So we have to fight in that order. We should not blame the COVID itself. So next slide. Well, sleep history that I have already told that when going to bed and waking up, and quality of sleep is more important than the duration also. And snoring, mouth breathing, restless sleep, that also indicates that it's not a quality sleep. Then past medical history of say thyroid disorder, asthma, or steroid use, that is also important to understand, particularly this metabolic syndrome. Then family history of lifestyle habit of parents, particularly diet pattern, screen time, exercise, because a habit is learned what is seen at home. So if father smokes, then the son is likely to smoke. In that way, so the lifestyle of the parents is also important. Then the pubertal status, ASMR staging is important. At what stage these changes are coming and what changes are likely to come, because this fatty spot and the insulin insensitivity and all other things starts in the say, early adolescent period. Psychosocial history is another important thing. Changes in school performance or attention and body image issues, any bullying at school, peer groups and friendship. These are all must come in the history taking.
Thank you, sir. Thank you so much for mentioning all the relevant points in history that would help us to identify the underlying causes, the contributing factors, and psychosocial history. I think that's very important. We take general history in all our pediatric patients, but what stands out in the case of adolescent patients is the need to take a psychosocial history to unravel all the deeper issues that you mentioned, sir, like in obesity, body image issues, mental health, and bullying and peer pressure and all that. So here we will pause for a role play scenario to find out how. So here the doctor is engaging the Rishi and his mother in a conversation at her clinic, and let's see what it unfolds. So here. Should I be stop sharing, Kavita ma'am, for the role play? Can you project three of us on the screen?
I have done spotlighted on all three of us. You just stop.
Okay, so I need to stop sharing now. So the doctor here would be played by Poonam ma'am. She is a warm, empathetic, but gently firm composer. She will be holding. And mother would be played by our Dr. Madhushri ma'am, Mrs. Sharma. She is a working mother, well-meaning, but overworked and defensive she would be. And myself, I would play Rishi, the 12-year-old boy, overweight with a low self-esteem and sarcastic at times. And the consultation the room is the scene. And over to you, Poonam ma'am.
So, hello, Rishi. Hello, Mrs. Sharma.
Hello, ma'am.
Please be seated and make yourself
Thank you.
So, Mrs. Sharma, as you have discussed on telephone that you are a little bit concerned about Rishi being little inactive and little irritable these days. So, Rishi, how would you like to have this session? Like, would you like to talk to me all alone, or would you like to have your mother along with you in this session?
Whatever, ma'am, the way you want. Maybe mom can stay.
Okay, so I get it. So for as of now, all three of us will sit together and we'll discuss. And Rishi, at any point of time, if you feel like you don't want to talk on that topic, you can just convey it to me. Or if you want that, Doctor, I need to talk to you alone, you can definitely convey it to me. So tell me, how are things at home these days?
Fine, I guess. Mom's always working. Dad's also not around much. It's just me and my sister, mostly.
Mrs. Sharma.
Yeah. Oh, that's not fair, Rishi. I do everything that I can do for you, and you know why I'm late in the evening because I am doing full shift throughout the day. So this is not fair.
I can see that this is a little sore spot for you, Rishi.
Exactly. Mom, just what I just said. No, you are not around.
So, Mrs. Sharma, you need not worry because you are doing your best. Why I'm putting this question? I just want to know about how the daily life at home, at school looks like. So, Rishi, how are things at school?
School sucks. I don't go for physical education classes anymore.
You don't?
You
No, what's the point? Everyone just laughs at me anyway.
you never told me this.
Because you wouldn't listen. You just tell me to ignore them and go walk it off or something like that.
That sounds really painful, Rishi. Being teased like that. It can really hurt. So, have you ever talked to your school teacher or your counselor about it?
Huh, like they care.
Okay, so what I get, like you have shut down, you don't want to talk about it. So, let us discuss like how your daily eating pattern looks like.
I skip breakfast most of the days, grab some samosas or Maggie maybe at lunch, and after school I am home alone. So I watch YouTube and eat whatever is in the house, chips, sweets, whatever dad brings home.
I pack him fruit lot many times, but he doesn't eat them.
Yeah, mom, you pack at 6 a.m. and it's half rotten by the time I see it.
So food is just not food. It is tied to when and how we eat it. So eating alone definitely is boring because you have shared that your sister comes very late in the evening. So Rishi, do you ever skip your meal while you are hungry?
Sometimes I'm hungry, but I don't eat at school. I don't wanna be stared at.
Okay, so that makes sense. It is not just about the food in your plate, it is how you feel while eating the food. So, apart from food, what else do you enjoy? Like outside the school or watching YouTube? Apart from watching YouTube, what else do you enjoy, Rishi?
Mm, nothing really. I used to like cycling, but don't go out much now.
Once upon a time, he was such a nice kid with an activity all over, and now he has changed for something. I don't know what happened to him.
Puberty, mom. That's what happened.
That is absolutely true. Moods and bodies, they do change during this puberty phase. So, Rishi, there are few children who smoke or drink just to diffuse their stress. Do any of your friends smoke?
Yeah, few of them. But I do not belong to that gang. I'm not interested.
That's such a clear and it shows your strength. That is really good. And these days, many younger children they have their special girlfriend or boyfriend, special friend for them. Do you have any?
Um, I don't think anyone would want to date me. Not like this, not like the way I look.
Oh, my sweetheart.
Just live it, mom.
Okay, I hear you. Feeling invisible, unlikable. It actually really messes up how we see ourselves. So, Rishi, there are a lot many ways through which we can change the perspective or we can work on it, like how we see ourselves without any judgment. Would you like to talk about it?
Maybe. I don't know.
Yeah, Rishi, we are in doctor's chamber. Just tell us what we need to do now.
Okay, so maybe with this, maybe we can really start working together like a team. Uh, it is
I
not,
guess.
it won't be about doing dieting or going for exercises. It would be basically building your life where you feel stronger emotionally, socially, and physically as well. So, Mrs. Sharma, we'll meet very soon, maybe next week. We'll take one step at a time. Thank you
Okay,
so much,
thank
Rishi.
you.
Take care, Rishi.
Thank you, ma'am. So that was the role play. So I think the conversation went smooth and it was empathetic and non-judgmental. And there were a lot of validation from the side of the doctor towards the emotions of both the child and the mother. And what came out as the red flags, there was bullying, isolation, family disconnection, and at the same time, some protective factors too, like an honest communication was there, the parental willingness to support is there, and the child's has no interest in substance. So all these, I think, would help us to address during managing this case, taking help of the protective factors. So I would like Shukanta sir to kindly comment on this play and if something went wrong or how could we do it better or any suggestions from you, sir.
Well, thank you very much. Am I audible?
Yeah. Yes, sir.
So, this is, I should say, an ideal presentation. But at the same time, I should also mention that the adolescents, particularly when there is a conflict with the mother or difference of opinion, so there is a scope that the adolescents might have something to tell to the doctor, which he or she doesn't want to tell in front of the mother. So adolescents should be heard separately. That should be told at the beginning. Initially, it is the doctor said that, but the adolescent at the end should be given some scope. So, do you want to have a session separately with me after your mother leaves? So this could be a part that could elicit some new points, particularly when there is some conflict or difference of opinion uh, that is reflected in the interview. Thank you.
Thank you, sir. So, from history, let us find out what physical examination findings were about Rishi. So, I'll highlight only the relevant points which would discuss today, like the anthropometry. Is very important to take anthropometry in such cases of increased weight. And the height of 155 centimeters, the weight 60 kgs were measured. The BMI plotted was 25 and measured was 25. We went for a waist circumference for this child, so it was 92. He was in stage 2 puberty and a blood pressure of 130 by 85. And dark patches were noted on neck and axillae that show were due to acanthosis nigricans, and the rest part of the systemic examination were normal. So let's see what these anthropometric measurements looked on the growth chart. So though the height of 155 was above the 75th centile, the weight was between 90 to 97 percentile. And when the BMI was plotted, it was well above the 27 adult equivalent. So it was a case of obesity. And weight age and height age also were plotted and compared. And the weight age were well ahead of the height age and chronological age. So considering the history and the physical examination, we diagnosed it as a case of a simple obesity, and then went far to see whether the child also has a central adiposity. So we did the waist circumference and plotted it on the relevant chart, and it was also above the 95th percentile. So it was increased central adiposity. So there was a risk factor for cardiometabolic complications as well. So the BP 130 by 85 was also assessed in a standard chart by age and height percentile, and it was in as a stage 1 hypertension. So here we have Rishi, a 12-year-old who is obese, has central adiposity, and has developed stage 1 hypertension, and has acanthosis nigricans, suggestive of insulin resistance. And now such cases are not at all uncommon in our day-to-day practice. So it is very important that we take anthropometric measurements in such cases and look for all the metabolic health parameters. So here I would again pause and invite Dr. Madhushri ma'am for her expert comments. Ma'am, we rely a lot on BMI for classifying weight. So how sensitive is BMI in diagnosing obesity, particularly in relation to cardiometabolic risk? And are there more appropriate measurement indices that we can use?
Yeah, Santa. BMI is widely used tool for assessment of weight related to height, but has a significant drawbacks in diagnosis and treatment when used as a sole metabolic screening tool, because it does not differentiate between muscles, bone, and fat. It can misclassify the individuals with high muscle mass, like athletes, as overweight and obese, and it can underestimate excess body fat also. Body fat distribution, especially in Asian peoples, it is more of abdominal obesity than Europeans one. They have less chances of having abdominal obesity, and we have obesity and overweight at lower BMI. So that is not included with this BMI screening tool, and it does not differentiate considering the age, sex, and ethnicity. And there are many drawbacks, because it may be a potential stigmatization of a person who is not overweight like athlete, and it may cause a mental stigma or mental problems also. It gives an inaccurate risk assessment, and then it will be a necessary intervention will be done, and limited guidance for treatment. So there are other tools which are waist circumference, waist hip ratio, or weight height ratio, and body fat percentage measurement by bioelectrical impedance and DEXA, that are direct measurement of body fat in an individual. About waist and hip ratio, this is a WHO protocol in males, excellent less than 0.85 and average is 90 to 0.95, and more than 0.95 is a risk of getting metabolic health, and the females are value differs. It is more than 0.86, then at a risk of metabolic health. It is already there how to measure waist and hip impedances, and this gives the fat distribution in upper body and lower body. So it is more rather it is more important to take this waist hip ratio, and it gives a proper risk that whether the patient or the person has a cardiometabolic risk or not. So it is well taken by WHO as one of the best protocol in routine screening of the overweight and obesity. And then coming to the waist to height ratio is also a screening thing for obesity and cardiometabolic risk, because it also is an anthropometric index for central obesity. It's very easy to use, and it is not based on age and sex dependent cutoffs. Weight and ratio of 0.5 can be used in different sex and ethnic groups, and accepted as universal cutoff for central obesity in children more than 6 years of age and adults. But it has not been validated still for a preschool children. The simple message is keep your waist circumference to less than half your height, and it may be particular useful. So along with BMI, we should do waist circumference, waist height ratio, waist hip ratio, and waist to height ratio. These are the perfect screening tools to have screened the obesity and cardiometabolic risk.
Thank you, ma'am. Thank you so much for explaining it so well. And here I would again get back to our expert, Dr. Shukanta Chatterjee, sir. So you mentioned about obesity and insulin resistance and how it is associated with so many comorbidities. So it's imperative that when we see such a child, we have to screen for those comorbidities as well. So, sir, how to go about it?
Well, when we screen and get some screening factor positive, say clinical screening, then it is important to go further for, say, lab screening also, along with the clinical screening that we have talked so long, so far as the BMI and then the waist circumference and height and ratios and all that, the clinical issues that we have talked about. The most important issue is screening the hemoglobin, I mean the blood glucose. So blood glucose again could be assessed by, or the control of blood glucose, I must say, that could be assessed best by the hemoglobin A1C, which is less than 5. Then that's the best control. 5 to 6.5 is considered, say, a borderline. And this is important that HbA1c and then fasting blood glucose we must do, and 2-hour blood glucose also. And the levels are already given there. So any fasting blood glucose more than 100 should be considered, say, deviating from norms or screening positive. Similarly, this is pre-diabetic. Now, to call that the adolescent is already diabetic, the same parameters could be used, and the indicators are the HbA1c should be 6.5, fasting blood glucose more than 126, and 2-hour plasma glucose is more than or equal to 200. Random plasma glucose of 200 or more than 200 is classical symptom of hyperlipidemia, because 200 if you get at any time, be it fasting or postprandial or whatever, it doesn't matter. That means there is abnormality of blood glucose maintenance, and this is diabetes. Similarly, hyperlipidemia should also be checked because the metabolic syndrome also develops hyperlipidemia, and we do triglycerides. The different labels are given: the LDL, total cholesterol, and HDL, and then non-HDL cholesterol. These are the levels are already given. These are really good screening metabolic parameters so far as lab is concerned. Yes, next slide. Now, again, the clinical parameters we have already mentioned. Shanta has clearly shown the charts also, the different percentiles of the blood pressure. So, pre-hypertension and hypertension we can define by the percentile of blood pressures that is mentioned here. Then non-alcoholic fatty liver disease, ALT should be more than 25, then that we should call it screening positive for a comorbidity of NAFLD. Then polycystic ovarian syndrome, free and total testosterone, and the sex hormone binding globulin. If they are more than normal, then we should consider this is a positive screening tool for polycystic ovarian syndrome. Then obstructive sleep apnea, if positive history is there, then the case should be referred to a pulmonologist for further detailing, and overnight oximetry will not suffice, which clinicians can do. And finally, psychiatric evaluation should also be done. If there is any positive history of, say, uh, not taking interest or having episodes of, say, depression or lack of interest to or lack of concentration even, then that should be referred to a psychiatrist for further detailed evaluation.
Thank you, sir. Thank you for all the elaborate explanation. So we did all these blood report in our case too, and the fasting blood glucose, HbA1c, and the lipid profile, the liver function test, they were all beyond the normal range. So Rishi satisfied the metabolic syndrome criteria, the clinical lab criteria, whatever it is there. So he had a central obesity and in the form of increased waist circumference and impaired glucose tolerance, hypertriglyceridemia, HDL was less than 40, and a hypertension too, BP with more than 90th percentile. So he was diagnosed as a case of obesity-related metabolic syndrome with risk for non-alcoholic fatty liver disease as well. So my question to Madam Dr. Madhusri ma'am. Ma'am, we are seeing increasing cases of metabolic syndrome, obesity in the adolescent patients. And mostly it is the unhealthy eating that we contribute to for this obesity and metabolic syndrome, mostly, though there are multiple factors. So, Madam, I would want to know I'd request you to give us a detailed, a little more in details about adolescent nutrition and how to go about adolescent diet.
Okay, Shanta, I will share my slide.
So, ma'am, I'll stop sharing here. So, ma'am, please continue.
Excellent presentation by Santha and Sukanta sir.
Yes.
Thank you.
Thank you, ma'am, for the encouragement.
Praise the youngest member.
Yes.
Yes.
That is why I took her name first.
Thank you, ma'am. Thank you for the kindness.
Should I start?
Yes, ma'am.
Please.
So it is there, no? Good
Not yet.
afternoon, everyone, and thanks, Chairperson Dr. Hima Bindu Singh, past Chairperson Dr. Geeta Patil, and Chairperson-elect Dr. Sushma Desai, Madam, for giving me the opportunity to talk on the most important topic in adolescent health, that's the metabolic health. And I pay my regards to respected Tuteja sir and all the HS stalwarts present here today. And it has been said that food is overuse or misuse drug for anxiety, while exercise is least use for depression, meaning to say that unhealthy eating habits are going to cause a negative consequences on the metabolic health of a person. You all must, or most of you must, uh, agree with me that we are, as already Santa has explained, that we are getting more and more number of children and adolescents with obesity and overweight. So it is the high time to talk on. And then moving to my another slide.
Ma'am, your
That,
slides are not visible. You have not started, your slides are not visible. You have not started sharing screen.
okay, I have not started.
Yes.
I should close the presentation then first. Presentation is there, no? First I have to share.
प्रेजेंटेशन को अपनी लैपटॉप पे पहले ओपन करके
ओपन
फिर
किया हुआ है, एक मिनट.
पहले वो शेयर स्क्रीन पे क्लिक करिए मैम.
हाँ. Here, and then I will. Now it is there?
Yes. The slides, yes, they are
Yeah.
there.
I will have to have.
Yes.
Yes. So right now it's visible?
Yes, yes, it is visible.
Yes. And what I did say just now, these are the cases from my routine OPD practice. Manisha, 11.3 years, visit for pain in abdomen, but her BMI is 24.26, that well above the overweight. Her thyroid function is abnormal, and her liver function with abnormal AST and ALT with USG report grade 2 fatty liver, and her father is having grade 3 fatty liver with hypertension. Rahul, 14 years, visits for URI, and mother complains gaining weight. He eats only home cooked food and he snores loudly at night. He also have a dark patches around neck and axilla, and his BMI is well above the obesity, 28.54. Gopal, 20 years, engineering student, because he is coming to me since day 3 of his birth. So they are reluctant to go to any physicians. So I have they are still consenting me, and he is found to have a BP of 155 and 110. His BMI is 34.17. His triglyceride levels are 378 milligram per deciliter, and he has a strong history of diabetic in his family. Sonam, age 13 years, visited for recurrent cold, but at first she was very adamant that she will not visit me, as every adolescent thinks that we are judgmental because she has excess body weight, and her BMI is 37.95, and now it is the high time. The epidemic of metabolic health is banging on our door, so we should act proactively and start screening this patient for early diagnosis, intervention, and proper treatment. And I will be talking on these points: importance of adolescent nutrition, aim of dietary modification, what are the risk factors, and what are the guidelines for dietary therapy, and what are the interventions needed for it, and why we need to focus on adolescent nutrition, because you all are aware that the adolescent is a time of increased nutritional requirements, and growth during adolescent is faster than any other period of time, so the requirements are more. And at present, you all are aware that India is facing a challenge of triple burden of malnutrition. At one end, we are topping the list of countries with malnutrition, and on the other hand, we are ranking third with countries with highest obesity. We also have a macro and macronutrient deficiencies, so we should have a macroscopic focus attention on adolescent nutrition. So investing in adolescent nutrition means that a healthy adolescent today will be a healthy adult and healthy parents tomorrow, and the healthy mother will give birth to a healthy child, so that intergenerational malnutrition will be well taken care of, and we will have a healthy adolescent. And let's come to the ground reality of the question. This is a very serious and concerning facts now we are getting through CNNS, that's a Comprehensive National Nutrition Survey done between 2016 and 18, well before the COVID. So we should not blame the COVID only. Only 40% of our adolescents are taking milk in their diet. 20% are taking pulses and green leafy vegetables. 1 out of 10 adolescents consume fruits and egg daily. And over to this, Comprehensive National Nutrition Scheme also says that 50% of our adolescents are at risk of getting diabetes mellitus, cardiovascular diseases, and hypertension. Physical activity is the tune of only 10 minutes per day in adolescent girls, while boys supersede some to 40 to 50 minutes. And on the top of that, the salt consumption is more than twice as had been advised. And why this is so? Because in spite of persistent and continuous effort by various agencies, government of India having public health intervention targeting the early childhood, adolescent, mothers, gestational age, why it is so? It has been said, other nutritional experts have come to the conclusion that the inclusion adolescents are not included in strategic planning of this in public health programs. That may the reason, because they are facing lot of barriers or nutrition risks at their level. So let go on that point, that what are the risks or barriers they are facing at that level. They are at individual, in adolescent themselves, they move out in their family and social, and their environmental. All these three factors are interrelated with each other. And as the adolescent go out in the society, his brain becomes a social brain, and he gets impacted by various healthy and unhealthy behaviors of eating and having a healthy and unhealthy exercises. There is lot of food restaurants and outlets coming, and peer pressure and all these factors. We can extrapolate factor in from the clinical cases. Just we have seen in case of all the four cases, their family and they lack the healthy food habits, healthy lifestyle habits. Their sleep is compromised, the screen time is poor, they are skipping the breakfast, they are eating because in case of Gopal, you must have noticed that he don't get a healthy food in his canteen at 4 a.m. So he is compelled to eat that junk food, and he is keeping his dinner because the food from the mess is not tasty. So these all the factors together has causing a obesogenic environment around our adolescent. And how it can be taken away from them, we can't take it away, but we can really modify these factors. And how to modify? Because our adolescent Gen Z have concept that we know it all and we only are going to solve it. So that problem has to be solved, because we know it all but we can't do it, is their answer. And how to come to the terms that they need a nutritional guidance, it is a very difficult task. And how should we go that? Let's see in further slides. What are the general principles of dietary therapy and ensuring adherence and compliance? And that motivation for the treatment is more important. And that will be, I will be talking this from the Dr. Preeti Galgali slide, thanks to her, from the Teen Nutrition Canadian framework from 5 A's. Ask for permission to discuss weight in a non-judgmental way and explore readiness for behavioral change. This is the first and foremost step we have to do. Then only when the adolescent gives his or her permission, then we can move forward for the dietary guidance. Assess obesity related mental and metabolic complications and comorbidities and root pathways in adolescent themselves and their family around. Advice on the obesity risk, treatment benefits, and step-up care management options to ignore the unhealthy health. This should be the goal, and agree on a smart plan according to the root pathways to have a sustainable goals related to improved health. Assist in addressing their expectations, their barriers, refer to expert because it is a multidisciplinary treatment. They should agree to it and arrange for a lifelong follow-up. Now, how it can be done? It can be done by small attainable steps or the smart steps. First, we should start contracting with them. They will ensure the adherence and compliance to the treatment. That is first assure, and then they should start getting their personalized weekly goals. They should register, maintain, or register their daily intake of the foods, of healthy foods. They should have their self evaluation and self regulation. They have to manage if they will eat on one in the snacks, unhealthy snacks, so they have to reduce their calorie content in the dinner or any other meals they are taking. That way they have to do the self regulation. We can give them the options only, and then they have to take that options in their own way. Involve the family. The person cooking the family is the most important person. Unless and until we take into consideration that person from the family, it is not going to have the fruitful results. And repeat the personal benefits. It gives a motivation to continue the treatment, and continue the treatment for at least 12 weeks. This is the motto or general principles of dietary therapy. And psychoeducation is must in these cases. Otherwise, they will revert back. They will not follow your advice or their options given to them. So they have a realistic expectation that there are range of barriers to weight loss, but not they are not recognized by them. It should be done by asking open-ended questions, that what do we know about the root of obesity, and what do you think, what is your, how you will activate your metabolism by doing proper sleep hygiene, proper exercise, proper screen time, and that the option should be given to them only. What is their concept about healthy lifestyle? What is their healthy weight loss for them? What is the role of your family? And what if you have a dip and weight is not under control? So they should not blame themselves and others also. After coming to these terms, then only we can proceed with the dietary guidance or dietary nutritional counseling, it is said. And it should be an individualized diet plan, because everybody has different problems, everybody has different weight, and everybody has different metabolic rest. So it should be an individualized diet plan. They should have a well balanced healthy meals. They should limit fast food and sweetened beverages. And main thing in all this is portion control. They should limit the portion control. That's the main important thing. Then only the weight loss is possible. Snacking fourth meal, it is very common in every adolescent, because they are studying, they are either on a screen, a midnight meal, and this should be totally avoided. It should have include small gradual steps and permanent changes, then only it will occur. And involvement of family is a must. We should have consideration for eating cues, like they feel bored, they feel anxious, they feel depressed, or they feel stressed. They cope with that emotional eating. So it should also be curtailed. You can't stop at all. And we should advise, or we should give an option of having mindful eating 5210. That is our SS program. Everybody of you are aware of that. Early intervention. Why it is early intervention? What is going to achieve it? It's going to avoid, to reduce the speed of crossing sentence, and that's what is needed in early stages. Don't try to go very fast, because slow and steady wins the race. And that is same with our adolescent. Avoiding force feeds are essential steps for dietary modification. In case of Gopal, as you already said, that his canteens give only unhealthy snacks at 4 p.m. So I have given him an option, or rather little bit of advice, that instead of taking 4 samosas, you better take only 3 samosas and replace it with handful of roasted chana or a apple and all a low fat milk, and that he is following also. Timely regular meals, avoiding constant
And
grazing during
Madhusri
the
madam, Madhusri madam, your slides are not moving.
She's
No,
speaking on
I'm
this slide.
talking this slide, sir.
She's
Oh, on
speaking.
this slide you are talking.
Yeah, timely
Okay.
regular meals, avoiding constant grazing during day. It is important. We should tell them they should not skip the breakfast, they should not skip any meal, and they should never do the dieting. So on these pathways, we should guide them. We will tell them, or we'll give the option that they should not indulge in junk food, reduce the consumption of high fructose, high fat, high sodium, or processed food. In that way, we should go. And how it will help them to reduce their weight, because strategies to reduce diet which induce oxidative stress means that when we eat a high carbohydrate and high fat diet, it is very well digested and absorbed by intestine, and it gives a blood glucose peak immediately, and this blood glucose rise has an overwhelming response from the mitochondria of the cells, and they start storing free radicals in circulation. Basically, it is a disbalance between the formation of free radicals and the active antioxidant mechanism in the body. So increasing intake of dietary antioxidants in the form of plant-based phytonutrients is a very good option, and these are polyphenols. All of you know it. Plant-based antioxidant acts as anti-inflammatory by altering the genetic transcription factors, because these transcription factors are the protein ones and they are attached to the DNA, and these phytooxidants, they change the DNA of the and come to the healthy genetic components. So in that way, they are acting on the genetic transcription factors also. As their action is short-lived, ideally one should consume antioxidant-rich food with each meal and snack to continue steady supply of blood-borne antioxidants to help to buffer and eliminate postprandial oxidative stress throughout the day. And what are the dietary recommendations from the statutory bodies such as ICMR and National Institute of Nutrition? You all know this is a typical Indian concept of thali. Half thali should be of green leafy vegetables and various colored fruit vegetables at rainbow colors, it is said, and various fruits. And half thalu, 1/4 should be of cereals and carbohydrates, and one should have protein along with 250 ml of low fat milk, buttermilk, kanji, nibu pani, and all that to give the other micronutrients and macronutrients. What is a healthy meeting? The portion control I already told you. This is choose my plate from dot government. This is a USA concept, and this is a very well concept of our Indian thali, and it is the best diet we should consume. There are three basic food groups: that go foods, that gives the energy, that contains the cereals and the fats and the sugar, and then we have the grow foods. They help them to grow the body. These are the pulses, lentils, legumes, and other things, and milk products, low fat milk or buttermilk or milk from the vegetable source such as almond milk, soya milk, or tofu. Glow foods are the protective foods or immune booster. So we should take a katori, 2 katori or 1 katori of green vegetables. We should take also the multiple color fruit vegetables. Also, we should have 80 grams or medium size apple, banana, orange, or mango. And we can have peach, almond, what is available and what is palatable to our adolescent. We should also advise them to take fibers and snacks containing dry fruits. Handful, that's 30, it comes to 30 grams, handful of roasted chana or roasted peanuts and dry fruits if it is available or affordable to them, that gives polyphenols A, C, D, and vitamins also, that adds to the value of food. And hydration should be only by water and alone. No energy drink is advised. Avoid junks and creating awareness about the label reading. And we should also advise them to follow the traffic light approach. Green for go, eat as much as you want. Yellow or slow can eat, but with limit, with the sometimes foods. and red raw foods, once in a while foods. And this is very good approach. If they follow for a long time, they have a consistent loss of weight, and it's very motivating for them. They should have the dietary supplements, vitamin D, B12, C, and multivitamins, minerals such as iron, calcium, zinc, and iodine, especially the menstruating girls and the athletic boys and girls also. Immunity booster herbs such as ginger and curcumin, and our spices are very good polyphenols. So not to use high protein and creatine. That's the message we should give them. And fat diets, as they are very much inclined to experience the new things, they are very much inclined to have the new choices, because it is all, they are pressurized by their peer pressure to have it. There are a lot of fat diets are trend. These are the trendy diets pattern known to be a quick fix for long term problems. There are various problems. The vegetarian diet is environmentally friendly, but it lacks the iron, calcium, vitamin, and zinc. And then the high fat diet, it's a fashionable diet because it has a high fat and low carb, and our adolescents are used to have the carbohydrate rich plate, so it is not accepted easily by them. And if at all the fat contents become high, as already Sukanto sir, they have a problem of irritability, weakness, and so on. So it is not at all advised. The Mediterranean diet, it is moderate in dairy, red wine, and moderation. Lifestyle factors are also there. The WW diet, that's a wellness watcher diet. It's an online group. In that, they advise that we eat what you want to eat, but eat a balanced food and in moderation. And when you lose a weight, report online. So this is a motivation. This also worth some time. Intermittent fasting diet, 16 is to 8 plan. Eat in a given 8 hours and fast for next 16 hours. In practice, this works because total food consumed is reduced. And but we should advise our adolescent for only ELF diet, that is eat less food diet. That is the best diet that will give a sustained loss of weight loss for them. So we should they should avoid the fat diet because of these effects on their body. And role of parents, school, and celebrities and polymakers and adolescent. You all know the role of parents should be the role model. They should involving gardening, cooking, or the grocery shopping. Schools should have competitions, and through that they should know them the dangers of unhealthy eating. And celebrities should be prohibited to stop this, because these ads have a strong impact in our mind, because they are on social media on the most of the time. And policy makers should have make the food junk foods more, tax them more, and non-availability of junk food outlets near their school or near the coaching classes, and this should be strictly followed. But we should make adolescent as a change agent. Unless and until adolescent themselves are involved in all this, it is not going to work. They can give challenge to the group that 7 days junk free diet, and continuing winner will be the hero of the group. So it will be a motivation for other adolescents also. Sharing a meal picture on a digital platform and friends motivating to each other. Sharing label info on friends group and asking the opinion, shall I eat or not? An opinion poll which is readily available in WhatsApp. This is also a motivating for other adolescents. And healthy use of media by dialogue amongst adolescents from different schools and youth clubs, so they will have a healthy habits, or they will come to know what are the healthy habits have the negative impact on their body. Talk by youth leaders working for adolescent across globe, such as Bite Back or Ask for Change. These are the two youth groups working globally, and they should follow it, and they can talk on each, because now internet is a very good medium for them. And IRP has always act proactively to address nutrition and NCDs in children and adolescents. Our NCD group is working very nicely towards this. And Sankalpa Sampurna Swastha, our President Action Plan 2023, we all are involved in it. AHM Mission Kishore Uday initiative by our Silver Jubilee President, respected Dr. C.P. Bansal, and we are all work for this. IIP guidelines on nutrition and adolescent should be followed, and nutrition programs by Government of India, and latest one as told by Santa, Sugar Board by CBSE and Oil Board by Government India. They should read it very cautiously and come to know what to eat and what not to eat. And Fit India, this is a gamified approach and on digital platform. And Fit India mobile app is launched by government, and this app tracks fitness levels and offers personalized plans, quizzes and challenges for users, and making fitness more appealing for teenagers. Hello English and Life School apps by CBSE. Apps developed for students to learn a soft skill, emotional intelligence, and health awareness in an engaging gamified format, often trying back to the CBSE curriculum. Culturally tailored examples of cooking competition arranged with a twist by schools or NGOs. Festive fitness challenges incorporating traditional dance forms like Garba during Navratri or Bhangra also into the fitness routine, keeps it fun and culturally rooted. Yoga and meditation apps like Sattva or Yoga for beginners focus on mindfulness practices inspired by India's rich yoga traditions, helping teenage manage stress and improve mental health. These strategies rooted in Indian context can help teenage embrace healthier habits. Eat Right India campaign workshops should be done, and AHA can take Fit India movement sessions in the neighborhood, SSS program of IIP, and at the end, because all the AHA stalwarts and the central IIP stalwarts are here, so I end by appealing all of them that only focusing on the risk of the adolescent ill-healthy practices is not going to suffice. All the partners should come together and have a holistic approach involving adolescent as a change in will gain some hope. And I end my presentation by saying to eat is a necessity, but to eat intelligently is an art. So make our adolescent master that art. And thank you very much for patiently hearing.
Thank you, ma'am.
And now Santa will take over.
Yeah. So thank you, ma'am. I think you have covered very comprehensively all the issues related to adolescent nutrition, the challenges, and I think it would be a great guidance for us. So now, as ma'am has already spoken about the nutrition, so I would now request. Is the slide moving?
No, not moving.
No.
Santa.
So now it's moving, no?
No, yes, it started.
So
I'll
it's not
just-
full screen.
No, I'll make it, sir.
She's present.
Yeah.
Huh.
It's not full screen?
Yes.
No, make it full screen.
So I think I have to.
Excellent session, Madhu ma'am.
Thank you.
Yes.
Full of data and
Yes.
programs that's going on.
True.
Excellent by everyone. And thank you for making so much efforts for this program.
Thank you.
Now it's full screen.
No, it's not
Not
full
yet.
screen, Santa.
Not
No.
full screen.
Now it is.
Yes,
Now
it is full screen.
Now it is full screen.
Okay, I'll just scroll to the next slide. Give me a little time, please. Sorry. Shouldn't happen like this still. So ma'am has spoken about the nutrition part. So now I'd request Shukanta sir. Sir, what are the other ways that we can break the chain of NCTs? After eating, what are the things that we should be taken care of? Very briefly, sir.
Well, it's not only eating, but there should have activities also, particularly outdoor games. So that is very important. That has so many effects on the body, as it is listed here also. It increases physical fitness, weight check, improves brain agility and memory power, helps learn life skills also, keep engaged in creative and constructive work also. And it releases happy hormones. That's also good, very good. And then this is a just a picture that if you take the ideal diet more of vegetables and fruits, then the abdomen will not bulge anteriorly as it's shown on the right hand side. So this is a very good picture, and the calories are also given. The sleep hygiene is very important, as I mentioned previously also, that a good sleep is a passport for a good next day. So that is important, particularly in adolescent age group, when they have lot of activities to do, not only the social relations, the peer relations, developing, say, romantic relations, and at the same time, say, education and career building and all that. So good sleep is very important, and sleep deprivation leads to a lot of problems. So smart use of your smartphone, that is important. So we should never say that no smartphone. That is, rather we should say it is, let us convert digital distraction to digital attractions, and that should be the discussion with the adolescents, that how you can do good time management to make this smartphone use, and also take care of your all other activities for the futures. So substance abuse and metabolic health are very much related. That should also be taken into consideration. Uh, Along with discussion with adolescents, whenever you get opportunities, we must explore by the so-called HITS approach and all that, whether the friends are already engaged in that, whether the adolescent himself is engaged in that, or whether the adolescent desires it or not. The will, that is very important. So these are all issues that we should consider in taking the history of the metabolic health. Then shared pathways like poor metabolic pathways contributing to depression and anxiety, body image issues, mental health challenges can lead to poor dietary habits also. Because if you are not having good energy, or if you are depressed, then whatever you find, you might eat or you may not eat at all. So these are issues that might affect your nutrition. So interventions, spreading awareness, group activities, group projects with peer groups, particularly outdoor games, organizing study patterns, study buddies, planning healthy lifestyle days and weeks, group sports and exercise, sharing healthy and homemade diet. That is very important. Homemade diet, how to keep it for longer time and all that, that should be considered. And the adolescents should also try to experiment that and also test that.
Thank you, sir.
Information of lifestyle and resilience building. Resilience building is a big term, but that is very important to adapt to the present stress and strain and present day society. That's very important. The more the resilience, better is the chance to become successful, not only in health, but also in education and career. So these are all issues that we should maintain. Relaxation technique is another thing that we should discuss with the adolescents, and we should incorporate them to practice it. And
Thank you,
involvement
sir.
in social activities is good for mental health and
Yes.
for physical health and overall health. Thank you.
Thank you. Thank you so much, sir. I'm really sorry I ran the slides fast because I think there will be some time issues. So without wasting much time, I would stop sharing, and I would request Poonam ma'am for the next part of the session. Sometimes, as we know, that all this advice, as somebody was asking, that how to make the adolescents follow. So often we face challenges there. So let's find out how to go about it in Poonam ma'am's session.
Okay, thank you, Santa. And before I begin, I would like to thank Central HA, Dr. Hema Bindu Singh ma'am, and Dr. MKC Nair sir, and guest of honor, Dr. Tuteja sir, for giving me this opportunity to share my views on how to motivate a child at an individual level. My previous speakers, they have already covered the main chunk of today's program, like what is metabolic health, why it is important, and how we can motivate adolescent in general or society, how society can take up it as a project to so that early interventions can prevent development of NCDs in later life. So in the second half of session, we will be taking a session with a single adolescent on one-to-one basis, where we'll be trying to motivate not through instruction. We are trying to motivate the client's own need. We are trying to extract his or her own need, how to change. So, I'll be talking about motivational interviewing, and it is really difficult to cover this vast topic in just 20 minutes. So, I'll be just briefly touching few points. Like by the end of session, you will be able to identify the spirit of motivational interviewing and its various processes, understanding the stages of change, and learn how to respond effectively using PORES technique, which are the basic skills of motivational interviewing. And yes, this is today's session is both theoretical as well as practical based. So you'll find some action also in it. A 16-year-old knows that excessive screen usage is harmful, is worsening his sleep, but still sleeps late till 2 a.m. A 17-year-old started vaping just for fun. Now he becomes breathless during sports, yet he hides and does it. Parents are told that their child needs counseling. They agree, but they don't take that counseling session either due to stigma or denial. So my question to my expert, Dr. Sukanta sir, is like, why do people not change even when they know what is right? And why does awareness only doesn't leads to action? Like one of the person in the chat box, he was asking how to motivate people, because most of them are aware, yes, we have to reduce, we have to cut short the junk food. And Sukanta sir, what
Yes.
are the various motivational conditions where motivational interviewing really makes a difference? Or, in other words, how we can turn these stumbling blocks into stepping stone? Over to you, sir.
Okay, so it's all this rightly you have pointed out that uh, the adolescent know that this is not good, but still he is not able to change the behavior. So the knowledge is not enough. We know that knowledge and then attitude or motivation, and that ultimately leads to behavior or change. So that is important to understand that the mind is controlling everything. So what we think about a situation, yes, I think it is, I need to do some change, but I don't find any pathway. So I feel bad. So, and therefore, we try to find out some pathway. This is a positive point that the adolescent knows it, but doesn't find pathway. So we have to discuss, this is a part of the counseling. So the thought process ultimately leads to some feeling or the desire, and the desire ultimately changes the behavior. That is the simple set triangle of mind that regulates. This is the basic thing that the counseling is, or the motivational interview is valid when we get some positive points in the adolescents. The many things get stuck in two minds, means whether this or that will work. They want to be healthier, but they also want to feel comfort, acceptance, and control. So this might bring contradiction. So this is an entry point for us in motivational interview. And this is called, say, ambivalence, or say double opinion. So this is incredibly, just the previous one. Yes. So it's very common, and awareness leaves lives to be hard, but change, it happens in the heart, and the need of readiness, safety, and motivation is important. Next slide. So motivational interview is nothing but the client is stuck. Yes, but what to do? So that is where the motivational interview starts. They agree something needs to be changed, but keep thinking reasons how to do it. They tried and failed multiple times. They know it's good for them, but don't feel the personal need yet. External pressure is high, but internal motivation is low. Defensive behavior may mask underlying fear or shame. They are in pre-contemplation or contemplation stage. That will be explained later. They minimize the problem or avoid the topic.
So thank you very much, sir. So motivational interviewing works when the client, there's a discrepancy between where the client is now and where one wants to be. So by definition, motivational interviewing is a particular way of talking about the change and growth to strengthen their own motivation and commitment to change. It is basically a way of talking to people, because motivational interviewing has a concept like just a minute, that everybody has his own, everyone has own desire to change and capacity to change. So the basic, there are two phases of motivational interviewing. Like there are two phases. Phase one is building motivation to change, and phase two is strengthening commitment to change. In the first phase, we basically build motivation by learning about their thoughts, their values, and their goals. And in the second stage, we strengthen their commitment to change. So it is basically patient-centered but semi-directive and goal-oriented towards change. So before we proceed to motivational interviewing, various processes of motivational interviewing, let us first understand what is the STARS theoretical model of change. It has 5 steps, and the last, that is relapse, is optional. Some people say it is a part of change only. So the first stage is pre-contemplation, where the person is either unaware of the problematic behavior, or he is in a denial mode. He doesn't want to change, so he is in a denial mode. Yes, even I drink lot of alcohol, but what I like to drink alcohol, I love to be with my friends. So he is in a pre-contemplation. He doesn't feel that it is causing problems at home, like that. Then comes the contemplation phase, where the person starts getting some idea, like, yes, the boy who started vaping just for fun. Now he gets breathless when he's playing his sports games. So now he does think like, I need to change, but he still hides and continues vaping. So this is contemplation, by like he's becoming aware, but still in a dilemma. Like sir was saying, ambivalence is a part of motivational change process. So this is what the contemplation stage is. And motivational interviewing best works when the client is either in pre-contemplation or in contemplation stage. And people can be stuck in this contemplation stage for years before they take any step to change. Next comes a preparation stage, where the person intends to take action, or like that boy who was vaping. So he start collecting data, like what harm vaping does to his lungs, and how would be his life in near future. And then after getting prepared, they take some action. The boy, he stops intermingling with those friends who are into this vaping gang. And then comes the maintenance phase. And this is what, these are the 5 stages. But the maintenance phase is also very difficult, because the changed behavior is difficult to sustain, and people might relapse very quickly from maintenance to action or preparation or contemplation. So we have to motivate children or motivate people that relapse is a part of stage of change, and in whatever stage of change they reach, they can begin anytime from that stage only. Now, PACE is the spirit of motivational interviewing. That means we can consider it to be the foundation or the root of a tree of motivational interviewing. It is not what we say to our client, it is the way of being with someone. So the PACE acronym, it is partnership. It is not you, it is not me, it is we. So the counselor work with the client, not on the client. Then comes A, that is acceptance. Even if we don't agree with what our client is sharing, like what he wants is talking about, our job is not to judge, not to label or push. Only thing, we have to respect their autonomy. If they're not ready for any change, we have to leave it for with them only. Then comes compassion, because that is what the counselor should have in his mind. Like the well-being of the client is of utmost importance for the counselor. Now, evocation will be talking in detail in future slides about it, but evocation is what the core concept of motivational interviewing is, that motivation to change lies within the person only. They say that our job is not to fix their problem. We are not technician. Our job is to draw their motivation out, not to insert the motivation in them. So it is basically the attitude a counselor wears before saying a single word. Next comes the motivational interviewing skills. These are O's, that is open-ended questions like, how can I help you? How are you feeling? What are the good things that if you continue with your smoking, then how does your life looks 5 years from now? So open-ended questions, they uh, leave the grounds open for client to talk about it, and we get to know what their feelings are, what their thoughts are, or what their hurdles are, so that we can understand and then we can proceed further. Affirmations are gestures that validate the efforts of the client, their strengths, and acknowledge their behavior towards positive change. So, affirmation, what do? They build confidence in the person's ability to change. But most importantly, affirmation should be genuine. Then reflections. Reflective listening is more than just repeating what the client is saying. It is basically showing the client a mirror. We say reflective listening is show mirror, show mirror, show mirror. It is basically showing mirror to the client without getting judgmental. So the client understand, yes, the counselor is understanding my language, what I want to say. Basically, through reflective listening, we tell them that yes, we do understand the meaning behind their words. Like if someone says, I tried everything but nothing works, you might reflect. It sounds like you feel frustrated or you are exhausted from trying so hard. So, such reflective statements are more powerful than any advice. Then summarizing the session. Summaries is like collecting the snapshots, spreading them on the table, and then the client will pick up what are the thoughts, what was his feelings, and what are the contraindications for changing. Like if the client says, I want to quit alcohol, but I enjoy evening with my friends. So you can say, so on one hand, you want to be healthier or more in control of your life, but on the other hand, you want to be with your friends. That is quite a dilemma. So, by laying both the sides non judgmentally, we open the space for future conversation. Next comes the principle of MI, and this is how we should proceed through dares. It is developing discrepancy. The guiding principle that is DARE, it is designed to keep the conversation safe, team-led, and predictive. Now, developing discrepancy is slowly pointing out the difference. The client says where I am and where I want to be. So it is not by pointing out bluntly or saying, no, you have to reduce weight. No, it is not like that. We have to slowly build the rapport with the child. Avoid argument, because once if we start arguing, the client will show some resistance or the team will push back. So avoid argumentation. Roll on with resistance. When resistance shows up, like when the teen says, I have tried everything, but nothing works, we reflect back through reflective statement. The resistance isn't defiance, it is the part of process. If you remember that we all used to study in our physics class that there's initial inertia for any change of stage. Similarly, is because this is again a change of behavior. Now, expressing empathy doesn't mean that we agree to what client says, but it again tells the client, yes, it is an emotionally safe space and he can express anything. This opens the door uh, s- for further conversation. Now, support the self-efficacy of teenager, like highlighting their strength makes them feel, they feel like, yes, they are able to do, they have capacity to do. So the principle of MI is theirs. Then comes, these were all the processes, the principle, and are the qualities of a counselor. Now, before we proceed, we have to understand how ready our client is, and this can be brought out with few scaling questions, like from 1 to 10, how ready do you feel you are ready to make change? With this, we will be knowing about how willing they are, how able they are, or how ready they are, which is again denoted by an acronym VAR. Now, if the client says, so yes, I'm ready till 5, so it is the normal reaction, like we ask, why not 9? And if we ask 9, the client is again in a resistance mode and they'll say, because I have failed previously. And this is a hindrance to motivational counseling. This will demotivate that client. So instead of that, we flip the question and we say, why not 2? And then he'll say, yes, I have tried it previously and to some extent I have succeeded. So scaling questions, we'll be doing it repeatedly. So scaling questions are very important and then they break the ice and the clients start developing some confidence. Yes, he remembers I have succeeded previously. Or maybe this task is too important for me. That is why I'm ready to do it. So the process of MI has 4 steps: engaging, focusing, evoking, and lastly, the planning. So engaging, we have already engaged through ORS, through PACE. We have focused what is the problematic behavior. Now comes the evoking stage, which is the stage of change or stage of ambivalence. So ambivalence is not resistance. It is natural and expected part of any change. Ambivalence is ideal for motivational interviewing. Like when the teen says, I want to lose weight, but I love eating chocolates, they are telling that they are stuck. Our role is to gently explore both the sides and shift the balancing scale towards change. Now, let us see how to elicit change talk. The client, usually in the ambivalence stage, they'll say, I want to change, but I cannot change. But I don't want to change. I don't want to lose my comfort zone. So, how to explore ambivalence? Then comes the eliciting change. This is the thing we have to do it. It is through practice we'll be able to do it again and again, and we'll be refining ourselves, like asking evocative questions. How your life was 5 years before you started vaping, or 2 years before you started vaping? How was your sports performance? Ask for example, very extreme, like what is the worst thing that is going to happen if you continue vaping for now? Or how well your life would be if you stop vaping from now on onwards. Look backwards. Similarly, how your life was. Look forward. How do you imagine your life without the vaping? Explore their own goals and values. What are your future goals? What are the values? And then this increased change talk. This change talk can be further enhanced using the technique Dan Cat. Just imagine that it is there's hill, and that hill is of ambivalence. The uphill process is done, that is preparatory talk. When you climb up, that is a preparatory talk, and that consists of desire, why they want to change, their ability, they'll say, I can change, how much they are able. Again, the scaling question. What is the importance they want to change, and what is their need? So this is down, this is uphill process. Then comes the downhill process, that at once the teenager know what is their desire, how able they are, what is the need of changing. They'll have commitment, they will make change, they will activate, and they will take necessary steps to change. So here's a case summary. Prisha, a 15-year-old girl, was referred for remaining aloof and spending most of her time alone. Her eating patterns are inconsistent, often influenced by the trends in social media, with restrictive dieting followed by episodes of overeating. On head screening, she has few friends at school, prefers to remain isolated, avoids family interaction, and often skips meals with them, with the family members, citing, oh, I'm on a diet plan, she finds recently. Appears overly concerned about her weight and shape with frequent mirror check and negative self-talk. My question to my expert, Madhu ma'am, is what do you get from this head screening? Madhu ma'am, unmute yourself.
From the case summary and head screening that we come to know that Prisha has a low self-esteem and she has very significant body image concern. She's not going out, she's not mixing with anybody, and she thinks that she also tells that she's on dieting, so she wants to lose weight, but sometimes she will eat emotionally to take out the feelings of inadequacy and comparison. And if dietary changes do not give the desired results, then we should take the help of a counselor for motivational interview, and it's a good option. And now we will have a motivational interviewing role play using pace and hours, and it will build the empathy and evolve the change. And scenario setup is client is Prisha, adolescent struggling with body image and weight concerns, and acted by Dr. Santa, and counselor role will be played by Dr. Poonam, and the goals set are create a safe space, explore ambivalence, and evoke intrinsic motivation. And tools used are pace and word. So now over to Dr. Poonam and Santa for their role play.
So, hello Prisha, I'm Dr. Poonam Bhatia, and
Poonam, little bit louder.
okay.
Mm.
So, hello Prisha, I'm Dr. Poonam Bhatia, and before we proceed, I would like to tell you that this is a space, safe space for you, and you can talk about anything you want to share. So, what do you like to talk today?
Ma'am, I would like to talk about my weight gain. I have been trying really hard to lose weight. I have tried skipping meals. I have reduced high calorie foods, even tried intermittent fasting. It worked also at first. But now I'm getting all it back. I just want to lose weight at any cost, ma'am.
You're putting a lot of effort, Prisha, and the way you're putting your effort it tells that this matter very deeply to you, right?
Yes, ma'am, yes. It really matters to me. I hate when people call me chubby. It shatters my confidence. I want to feel confident.
So this is not only about your weight, it is how you see yourself and how you want other people to see yourself. Am I right?
Yes, exactly, ma'am. Ma'am, I've been literally starving. And my jeans, they do not fit in the way it did even last month. And I see all my friends, they're enjoying pastries and tasty food. Then, ma'am, why should I restrict myself? But still, I want to lose weight.
So it really hurts when you're working so hard and still feeling that you're not seeing the results, like your jeans not fitting the way it did last month. So it seems that you're stuck in between enjoying life with your friends and also wanting to feel good in your skin.
Exactly, ma'am. It's so confusing.
So, would it be okay if we talk a little more about both these parts, which mean really important to you?
Sure, ma'am.
So, Prisha, on the scale of 1 to 10, where 1 means you're not at all ready and 10 means you're 100% ready, Do you feel that you're ready to make small changes? How confident you are?
Ma'am, in a scale of 1 to 10, maybe 6.
Okay, so why not 3?
Because, ma'am, I have done it before. I know I can lose weight.
Good. So that's really encouraging. What do your current eating habits look like?
Ma'am, I have stopped taking all the junk food and have replaced them with fruit juices. I drink 2 to 3 glasses of fruit juice every day because it's healthier.
That's a thoughtful change. You swap junk food from something which you believe was better, but the weight is still coming back. So, can you just think what is going on?
Ma'am, maybe it's the juices because I have heard that fruit juices contain a lot of sugar.
That is absolutely right. That many fruit juices, especially the packed one, and even the natural fruit juices, they are full sources of concentrated sources of sugar, and that leads to insulin spike, which in turn leads to fat storage and weight gain. What does this? How does this information make sense to you?
Hmm, maybe then, ma'am, I need to replace the fruit juices with fresh fruits. And ma'am, what is the role of proteins in healthy diet? I have heard so much about proteins.
That's a smart choice, replacing fruit juices with whole fruits because that will keep you full. It will give you fiber as well. And proteins, they are the building blocks and they help you feel full for a longer time. So you don't feel that hunger pangs very frequently. Simple foods, protein foods that you can include in your day to day are something like eggs, chana, curd, paneer. These are the great daily sources which you can include.
Honestly, ma'am, I don't like most of those you mentioned. Eggs, though, are a big no-no for me.
So no eggy, no paneeri. So these are all no-go fruits for you.
Yeah, ma'am. Kind of, but peanuts, curd, and roasted chana may be okay.
Okay, so that is a perfect thing. So what you'll be including regularly in your diet?
Ma'am, then I think it would be curd. And sometimes chana even.
Okay, that is good. So can I ask, like, besides food, what else has been affecting how you feel?
Uh, Ma'am, when my parents push me to meet people, that's the time I feel really annoyed. And that's when I eat a lot of chocolates. And also, I'm sitting a lot. Schools, then tuitions, and studying. Not enough time to move.
So chocolates have become your comfort food, right? So what else can you do to feel better?
Ma'am, dancing, I really love to dance to the Bollywood tunes. And sometimes talking to my friend while walking. Ma'am, one quick question here. Can I still have chocolate sometimes? I would really love to have them.
But why not? Life is meant to be lived joyfully. You can replace normal chocolates with dark chocolates or 1 or 2 pieces of dates as well.
I knew you'd say that.
Absolutely, that makes a mindful choice. So let us make it a mindful choice. Like while you are eating a chocolate or you are eating a date, just ask the question from yourself, like whether I'm hungry or I'm stressed or I'm upset. How does this feel?
That feels fair.
Okay, so you have already identified some helpful steps like cutting juices, adding protein, adding whole fruits, and dancing or walking to deal with your stress. So now again,
Yes, ma'am. These feel doable.
great. So now once again, from the scale of 1 to 10, how confident you are that you can take these steps in the next week?
About a 7.
Good. So why not 8? How to make it 8? Why not 8? No. How to make it 8 now?
Ma'am, my mom really makes tasty, healthy soya nugget snacks. So I think I can ask her to make such snacks for me. Then I can add a bit of more protein to the diet.
That's a good step and doable step. You have already taken the first step, Prisha, again, by thinking through things you want to try, not the things anybody is going to tell you. Yeah, anybody has instructed you. So let us check
Yes, ma'am.
in the next week and see how you felt. This time we are just shifting our focus from weight scale to your feeling, how you feel emotionally. Thank you.
Thank you, ma'am.
Kanto, goodbye.
Thank you.
Excellent.
Thank you, ma'am.
Sukanta sir.
Yes.
Excellent one.
So it's a very well done. So I'll only say that so long we have said that we have to do this, the adolescents have to do that, but the change of behavior doesn't come by just lecturing. It needs some sort of
Practical
technique
things.
or some process. So that is what is being role played or demonstrated here, that the behavior change can only be done when the different steps are followed, like say connecting with the adolescents and listening them, and then evoking and then guiding the adolescent to take their own solutions. And this is clearly the steps that the motivational interview is just demonstrated, and this is how we have to make change. And more we practice, more will be efficient. That is very important. So like say intern, then house physicians, and then practitioners, and then experts. So this motivational interview and counseling is only, you have to follow the principles and practice. If it is one session not sufficient, then you have to follow the next sessions. As here, the Precious is now motivated to take another session, so, and also motivated to eat the mother's prepared meal, so that he can increase the scale of performance. So this is how we do it. Thank you.
And message from all of us? Or you're
No,
going?
no, ma'am. A few slides are still left.
Yeah,
So
sorry.
the therapist reflection is therapist validated her effort, not just her behavior, evoked internal motivation and her balance too. Avoided advice giving, kept on asking, what do you feel? How you can go ahead? Didn't said no to replace fruit juices with fruit. That came out from Prisha herself and helped her reframe failure into human coping. The outcome was that Prisha felt heard, not judged, and left the session with one small, self chosen goal, that is, healthy coping mechanism and reduce emotional eating. Now, the role of therapist, it keeps on changing at every stage of change. That is, at pre-contemplation stage, the therapist works as a nurturing parent. At contemplation, the persona of teacher, as they aim to challenge the client's beliefs and gain new insights about their behavior. At preparation stage, the therapist acts as an experienced coach, and in action and maintenance, they act as a consultant as they provide guidance and support when needed. Now, the biggest question is that, is every case fit for doing a motivational interviewing? No. If the client says, I don't care, everybody, my mother or my parents, they are forcing me to take this session, that is why I have come here. Or if she is completely hostile or disengaged with the idea of change, I don't want to change. Or if she only engages, okay, tell me what to do, I'll follow it. So, what to do then? Shift the rapport building to rapport building only, skip, don't talk about behavior change, use affirmations and empathy, and offer to revisit the topic later. So let us summarize today's session. The spirit of MI is captured by an acronym PACE, that is partnership, acceptance, compassion, and evoking. Core communication skills are open ended questions, affirmation, reflective listening, and summarizing. To change, sustain talk to change talk, use the acronym DARES, develop discrepancy, avoid argumentation, roll on with resistance, express empathy, and support their self efficacy. The darn cat helps us to recognize the change talk, that is desire, ability, reason, and need. And CAT, always imagine it as downhill process, commitment, activation, and taking steps. The four key processes of motivational interviewing are engaging, focusing, evoking, and planning. So, my take home message is never skip the planning stage, because the client has to know what is the exact goal and what is the way, what is the passage through which he has to reach over there. The planning is essential. So, when teen owns their why, and what is the role of counselor? The counselor has to create the space where that why will erupt. So when the teen owns their why, they'll find the how. And you don't have to move mountains today, just loosen one stone. Thank you, everybody. Thank you for patiently.
Excellent.
Great session and great.
Great.
Poonam ma'am. So, ma'am, can we have the messages from each of us?
Yes.
Just a minute. Okay, Madhu ma'am, start.
Sukanta sir.
Sir,
Yes.
Sukanta.
So should I start?
Yes,
Yes,
Well,
sir.
if we become the motivator or a counselor or giving the motivational interview, that is best accepted by our patients. They hate to go to say psychologist or a psychiatrist. They consider it something brain abnormal. So we should all practice it the way it is shown. We should follow the methods, or I should say the steps. And more we practice, more we become efficient. That is the message that I want to convey. Thank you.
So should I start then?
Yes, ma'am.
Everybody will follow. Eat right, live fit.
So eat right and live fit.
Hmm.
Ma'am, next.
So food is fuel, not a therapy. And I would also like to add, like mindful eating should be practiced by everybody.
Santa.
So balance your plate, energize your body.
Yes, Madhu ma'am, you can end.
Nutrition first always.
Yes.
And all of us together, eating healthy food
fills
your body, energy and nutrients.
Imagine
yourselves
smiling
at you
and
saying
thank you.
thank you.
So it's a national slogan.
Wonderful, wonderful, wonderful.
Thank you.
So thank you, the organizers,
Thank you very
for
much.
giving this opportunity. And it's a 2-hour long session. So we have tried our best. Himabindu has messaged me in the morning, and I told her that I'll try my best. So this is the show. It's you to comment.
Great, sir. It was a great teamwork. I think, Kavita, just my few comments, if you allow me to.
Please.
Yeah. So I think this metabolic thing, this is very important, not only for adolescents, for all of us. We all, day and night, we go through all this, karna hai, kaise weight reduce karna hai, kya karna hai. We are so busy, all those things. But for adolescents, they're even more challenging, because they have, this is excellent session. You showed practical tips. That is why this session is so important. We've been hearing theory about it. What is good, what is ideal diet, how much carbohydrate, how much protein. So that was quite theoretical, and we do here in many of our conferences and sessions. But this counseling program, what we have started as on part of Central AHA, is very special, because we are really showing the practical way of counseling for every aspect, which when you deal with adults in health. So when how to bring down, to handle a case of obesity, and how to improve the motivation. Motivation is extremely important. Unless they are motivated, change may not be there. So knowledge is not enough. That is exactly what you all said. So we need to act and motivate, and action is only after motivation. So I think these are the practical, very nice role plays, and the knowledge and the content of the slides was quite good, and role plays were excellent. Each one of, especially motivation interviewing by Poonam, I think was excellent.
Yes.
And we have excellent. Thank you, Madhu Madam, and Sukanta Sir, Poonam Ji, and of course, Santa. Thank you. Great. Thank you. Excellent session. I hope all the participants have enjoyed this and learned something out of it. I request all the participants to do practice this immediately. Please, when you attend these sessions, I request you to start practicing and handle these cases one by one. And this group will be mentored by our experts. I think even after the sessions have stopped, and we will continue to mentor you and help you in dealing with any difficult case scenarios. Thank you so much. Thank you.
Thank you. So before concluding, I would like to ask one question, Dr. Poonam madam, to answer this question to the audience. There was one question in the group कि जो पतले लोग होते हैं वो slimy and thin, they eat a lot but they are never fatty. So often if we go for their sonography, so there also it is seen fatty liver. So I would like you to answer this question, please, to the audience.
So basically, I would say that they are genetically, they have a lean body type and they may appear slim despite of eating so many junks and everything. But being slim doesn't always means that they are healthy. Excess sugar, salt, ultra-processed foods, they can silently affect their metabolism and their gut health. And that can again lead to what you are saying, to fatty liver, diabetes, and even early onset of other lifestyle diseases, regardless of their weight. So, healthy eating isn't just about the appearance, it is about protecting what is happening inside the body, too. So, anyhow, we have to adopt that healthy eating lifestyle. That is what I said, ki mindful eating is very important.
So the message is that slim doesn't mean that you are like supposed to or you have granted to eat junks.
Right.
And
There are multiple parameters. There are multiple parameters. It's not only BMI or the abdominal gut. Multiple parameters we have to take care, particularly in these days of stress and the problem of, say, lifestyle changes. Multiple parameters we should always evaluate.
yes.
There are not much questions. I think, Poonam ma'am, most of the questions are answered by you only. There was one question by Kurana sir, I suppose, ki when the MI should be started.
So that we have shown when the person is in pre-contemplation or contemplation state, like whether the person is in little denial or the person knows that there a problem exists, but I want to change, but I don't want to change. So that is the pre-contemplation and contemplation stages are ideal for motivational interviewing.
No more much questions.
Okay.
So it was really wonderful, extraordinary, wonderful session. So thanks a lot to all the respected speakers for your insightful presentation, and your passionate delivery and role play really made the topic really compelling. Kindly accept my humble gratitude on behalf of IAPH and all the audience. And I pay my gratitude to each and everyone present here, respected Dr. M.K.C. Nair sir, Tuteja, respected Dr. Tuteja sir and Basavaraja sir. Your words of blessings means a lot to AHA. It's a strength. It's motivating. Thank you all the audience. Your interest really gave us a lot of motivation to present still in a better way. So your enthusiasm was strength. So 2 more sessions are now remaining. I think next session is on 15th of August, Independence Day. So stay tuned with our team. And all the teams are working really so hard. People keep on calling me in advance so many days. So that is the strength and power of this program. Thank you,
Right.
everyone. Thank you.
Thank you.
Great. Thank you.
Have a
Thank
great
you.
day.
Thank you.
Thank you.
Bye.
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 Kindly share your presentations in the group, please, ma'am.
Definitely,
No.
definitely.
Thank you.
I'll share
For
it with you, or should we share in the group, delegate
group and participants group, so that all want to see it.
Okay.
Yeah. Thank you, ma'am. Thank you.
Thank you.
Thank you,
Thank
ma'am.
you.
Thank you,
Thank you,
Kavita.
Kavita.
Bye.
Thank you,
Thank you,
Kavita.
Good
ma'am.
evening.
Thank you. Thank
You
you.
all
Thank
were
you.
wonderful, ma'am. Santa ma'am, you're really good.
Thank you, ma'am. Thank you so much, ma'am.
She's a
Thank
new
you for the
discovery to Central
opportunity.
Asia.
Yeah.
Thank you.
Thank you.
Thank you, ma'am.
Thank you, Kavita. Thank you.
Okay.